I'm wondering if you would just go ahead and give us a quick tutorial on what xenotransplant even means.
So what does xenotransplant mean? It means a transplantation from a non-human mammal. It doesn't have to be mammal, but a non-human animal. That's what xenotransplantation means. And the pig or cow would be the likeliest choices. Initially, both were considered. The pig is sort of won out. Now, there are people that think that's unethical. There are arguments, but if you calculate the amount of pork and animals killed for eating pork per year compared to the 30 or 40 or 50,000 kidney transplants, it's trivial. So ethically, that argument doesn't hold sway. There will be new patients every year, right? So 100,000 new patients every year go on to needing some form of renal replacement therapy. So it's not going to be a one-time fix.
It's kind of interesting. I mean, this is off topic, but I would think too that if you kind of suddenly started mandating or encouraging pig farms to organize themselves so that they were surgical units, the pigs would have a better end, right? You'd be harvesting
very well
kidneys for
put in. Yes, that's well put. I mean, the thought is going to be, the problem is that they have to be what's called pathogen-free, unlike regular farming. There can't be any organisms in these pigs, virus or bacteria, so that requires a whole infrastructure, which has already been created. I mean, there have already been a few transplants that you might have heard of. There's one that just occurred about a month ago in a brain-dead patient. I think the kidney is still working, actually. And there were a couple of heart transplants also in the last year or so from pigs. So these are all patients that were going to die and will die, but just to show proof of principle and to see what issues will arise. But yes, I mean, there will be, if it's commercially viable, there will be pharmaceutical companies coupled with farming in different, probably you'll have a few areas in the country. You'll have heliports that will be flying these organs all over the place. You'll have to have the infrastructure at places like UCLA where the surgeons are aware of the subtleties as far as the biology, are able to do the transplantation, or they may fly the pig out and it'll be removed right at a place like UCLA. That all is the future we're likely going to be dealing with. I think everything we're talking about dialysis units and the prevalence of kidney disease is something that's going to be in the past in 10, 15 years. I think we're going to read about all this in a museum or,
Do you think the timeline's that short, 10 to 15 years?
I mean, human beings don't do well predicting things that far in advance, but my intuition is with what is going on now scientifically, both with the drugs that are slowing down the progression of kidney disease and the likely success because of the money involved with the xenotransplants and or the artificial kidney, I think it's going to occur. And also just the expense. I mean, for the US government to spend $115, $120 billion a year on kidney care only is something that's not going to be tolerated much longer. That's one of the other problems that to go to Congress now and ask for more money for kidney care, to fund more research for these things is just a non-starter. They already feel they're spending way, way too much on just looking after the current population of patients with the dialysis and transplantation.
Is your team working on artificial kidney?
Yes, so the tack that we took is to create a totally artificial kidney to replace the human kidney, not all its functions. The kidney is probably the smartest and most complex organ in your body, at least that's my bias, even smarter than the brain. And so it's highly complicated. It would be much easier to make a 747 than a kidney. A kidney is a very, very difficult structure. It's probably one of the most complicated structures in the universe, what it does, people think it filters and gets rid of poisons. It actually doesn't. I call it a chemical computer, where it keeps the chemistry of your blood constant. And you have thousands and thousands of different chemicals in your blood, and the kidney recognizes all of them. And its purpose is to, the chemistry of your blood is changing 3 times a day because humans eat. If you didn't eat, your blood chemistry would stay very constant. You wouldn't need a kidney as much. But because you perturb the chemistry to a great extent, and you have no idea what's going on, you just get the pleasure of eating, some organ has to get rid of everything that came in from the outside. And that's the kidney. And so it isn't just a filter, and it doesn't just get rid of poisons. It's a highly, highly complicated structure as far as what it does chemically. And so to replicate that, we're not naive. We're never going to be able to do that. But there are certain key functions that we have to replicate that we've been working on. So when we say an artificial kidney, we're not going to say, it would be like an airplane and a bird. You know, an airplane flies, it does certain things, but obviously a bird is a combination of a drone and an airplane together. So that's sort of the goal. When I say artificial kidney, I don't mean that it's going to replicate the kidney. So yes, that's what we've been working on.
That's great. We had a guest earlier today. I doubt you'll know his name because of how many patients you guys all see, but his name is Jim Isaacs, and he had just decided that he was going to be an anonymous donor. And he did all his work at Reagan, and he had just an excellent experience, and talked about how easy it was to do. You know, obviously there was a lot of planning, and he had to go through testing. I think he must have been 62 when he did it, right? Because he's 65 now. Yeah, so he went through all of the testing, and then got it done. Tells a funny story about getting on a bus to go over there. It's like, do you want to talk a little bit about the risk rewards involved in being an
Sure.
anonymous living donor?
Well, first of all, I think any human that would give a part of their body, and I've told patients that, or donors that, anyone who would give a piece of their body to someone else, especially someone they don't know, to me is an angel. I mean, I can't conceive of such a person. I mean, there's no greater gift than that. It's to me miraculous that any human, given the way our brains work, would even ponder doing that. So that's my first thought, that I honor people like this. I think they're highly, highly unusual. And so that's the first thought. As far as doing it, yes, you could take the argument that it's rather easy to do, other than the emotional part. As far as physically, you're out of the hospital very quickly. Taking a kidney out is not a big deal as far as technically and physiologically and medically. There's, the kidney's hooked up in three ways. There's the blood coming in, the blood coming out, and then a tube coming out called the ureter. It's not difficult to remove a kidney, and the recovery is quick. So in that sense, you would think maybe more people would do it, but they don't. So that's why it's so unusual and amazing that someone would do this. I can conceive of people doing it to their relatives or their spouse or whatever, but anonymously, that's a special kind of human being. So amazing. As far as the long-term consequence, so the short-term consequences we talked about, there's very little. Safe, if it's done in, it should be done in a good hospital. There's a whole other thing called organ trafficking, which we can get into if you want, where it's not safe, where people go and they get a transplant, or they give a transplant in a country where it's not safe, and there's a lot of money exchanged, and we can get into that, and then you can have disasters, actually. But if you go to a reputable program with good surgeons, you recover quickly, you're back at work. So that's sort of the acute short-term issues, and then your question, I guess, would also apply to what are the long-term consequences, and that brings up the thought, do you need two kidneys, right? All of a sudden you have half the kidney function, so your kidney filtration just went to half. But it turns out the body is smart. That kidney function doesn't stay half. If you follow that patient over the next year, the remaining kidney actually grows. So this person's kidney likely is bigger than it was before, and if you follow accurately the kidney function by measuring the creatinine or EGFR or these other tests, it's going to improve. It may not get right back to two kidneys, but it will improve. It's also interesting, if you take an animal and put in a third kidney, the other two shrink. So the body is quite brilliant in that sense. It sort of knows what the workload is and makes sure that the total kidney function matches your size and what you need. So there's this longer term increase in the kidney function, and you're left maybe, if you're young and you had the expected increase, maybe 75, 80, 85% of your original function. So are there any other long-term things? Well, some people say that in the long term, that kidney might be, and again, the data is not clear and it goes back and forth every year, to some increase in CKD. Maybe there's things going on physiologically and biochemically that might increase that chance of that remaining kidney getting damaged itself. And the doctors will tell you about this data, but it's not clear. It's really not clear. Why we have two kidneys is another question that would be a correlate of your question, and no one knows that answer, why we have two kidneys. Because you really only need actually 10%. So you can take both kidneys, let's call that 100%. You can go down to 10% before you need renal replacement therapy. We have a huge leeway of function. So even if you had one kidney left, you could still cut the function of that kidney down till the total was 10% of the original two before you needed dialysis or something else. So we have this huge backup. We have way more function than we need to maintain our blood chemistry, which is a whole separate question.
There was a couple people talked about this, that there are some statistics, and this is an iffy one, but that people who have donated a kidney live longer than people that don't.
I would continue to think that's iffy. I mean, there's so many. How you would even have a control group. I mean, what group would you compare it to? I mean,
that's the thing, right?